Okay, and now we can see your screen, yes. Okay, we can see your slides now.
Okay. You are welcome now. I will start my presentation about, but let me to make it from presentation that I show not okay. Okay, that's okay. It's ready now.
Yes.
Do you hear me? Okay, I will start now. It's okay. Everything is okay. Hear me?
Yes, everything is okay. Please.
Thank you. I'm Dr. Hala, Professor of Biochemistry in Shams University and Vice Dean and Dean of Sinai University. I will talk about today about my Luteolin mitigate tamoxifen associated fatty liver and the cognitive impairment in rats via modulating beta catenin. This is presentation. Our aim of presentation, we will talk about introduction, aim of the work, is design of the work, result, and finally conclusion. Our aim of this study is to study the effect, outside effect of chemotherapy for females that suffer from breast cancer. Breast cancer, it is a lot of people suffer from cancer, first of cancer, it is incidence in female. There is breast cancer, it took about 24% of cancer disease, its incidence. And regarding mortality, it's about 15% mortality female from death from breast cancer. So, what is breast cancer distribution? Our global cancer incidence are all over the world. It's unique about in America, 21%, in Africa, 5.8%, in Europe, 23.4%, and in Asia, 48%. The number of new cases of cancer has increased to 19 millions, and over 10 million deaths were recorded in 2020. In Egypt, there is new cancer cases in both gender. In Egypt, we make about some survey like this. We suffer here in Egypt from two bad cancer disease. The first one was high ratio and high risk is liver cancer disease due to virus C, but it's good. The second gender of the second disease is breast cancer, about 16.4% in Egypt. So what is our aim for this cancer? Cancer treatment took a lot of methodology. Number one, hormonal therapy. Number two, surgery, maybe bone marrow transplantation, chemotherapy, targeting therapy, radiation therapy, and immunotherapy. This is all for cancer treatment. But chemotherapy, we are focused on chemotherapy because it has proven it is the cornerstone for cancer treatment with hormonal therapy. But is a lot of complication results from chemotherapy. It is a major chemotherapy. It's a complication. It is a cognitive impairment disease. Chemotherapy, it's make a lot of side effects. Number one, it's make direct neurotoxicity, impaired neurogenesis, white matter abnormalities, oxidative stress response, immune dysregulation, cerebral vascular alteration. It's make also alteration of long-term potentiation and hormonal driven change. And finally, it's cancer treatment or chemotherapy cancer treatment induced cancer cognitive impairment. Our aim for this study is we know about, we hear, or all of us hear about tamoxifen as treatment. It is a big problem. Tamoxifen is the oldest, most prescribed selective estrogen receptor modulator. It was approved by FDA to treat hormone receptor positive early stage breast cancer patients. It's okay. It took a lot of many women took tamoxifen for a long time, for 2 years, for 5 years, for a long time. But tamoxifen, because it's good for treatment, it's most important adjuvant hormonal therapy for reducing breast cancer recurrence rate again. But what is the problem? Why we take this? I'll make this study because we hear several side effects. The most side effect is fatty liver. It's one of the most common side effects that has been frequently reported to be associated with tamoxifen. Also, it makes cognitive skill with lower score in verbal memory for female, and executive functioning had been demonstrated among tamoxifen users. So this study, we make another. We started to study the effect of tamoxifen. Hal it induce fatty liver or no? So we found that tamoxifen, injection tamoxifen rat increase reactive oxygen species, which increase JAK1 and pathway ERK. So it also increased nucleofactor kappa beta, which increased tumor necrosis factor and interleukin-1 beta, pro-inflammatory markers. Also nucleofactor kappa beta decreased interleukin-10 and also increased nitric oxide synthesis. So also tamoxifen induced reactive oxygen species, which increase a level of malonyl dialdehyde and myeloperoxidase enzyme, and this is all when it's all increased. It's means that I suffer from oxidative stress, and it decreased reduced glutathione, and also it means that I suffer from reduced oxidative stress. All of this make like inflammation, make cell injury, mitochondrial dysfunction, and finally it's lead to liver cirrhosis, then liver fibrosis and liver cell, and finally cancer or whatever. We must make liver transplantation after all tamoxifen for a long time. This is problem for women that take or treatment with tamoxifen. What is our solution? Our idea, we started to search about co-treatment to decrease this complication. We start to search about natural product to treat hair as co-treatment. Luteolin, we search about luteolin. It is new natural flavonoid, was proven to have multiple biological effects such as anti-cancer, anti-inflammatory effect, and anti-apoptotic and antioxidant effect. This is luteolin, so it's a good idea to make experimental design to improve, to say which one mechanism luteolin can affect or can co-treatment with tamoxifen effect on liver disease. How can we found luteolin? If you eat cabbage, carrot, broccoli, pepper, onion leaf, but here in Egypt we eat el-head, not onion leaf, and a lot of people eat remove apple skin and eat apple. It's not a good idea. We must eat apple with apple skin because it contains luteolin and it acts as antioxidant effect. So what is the role of luteolin as anti-cancer effect? It has effect on cancer. Yes, luteolin, it's act as anti-cancer, it's protect anti-inflammatory, and it has a role as anti-cancer effect through different mechanisms. It prevents angiogenesis, it prevents metastasis, it prevents cycling B and the tumor survivor invasion angiogenesis. through different mechanisms, through beta-catenin, through matrix metalloproteinases, all of these mechanisms. So luteolin, it is valuable flavonoid or antioxidant, anti-inflammatory, anti-cancer. In this study, we make design. So also it's another figures to show luteolin effect through GSK. GSK and luteolin and beta-catenin, this is area we started to search about this mechanism. How can luteolin affect cancer or affect on fatty liver through beta-catenin or GSK as a co-treatment with tamoxifen to decrease the effect of tamoxifen toxicity. So our aim to investigate the effect of luteolin on fatty liver and cognitive impairment that are associated with tamoxifen treatment in experimental rat model. Our design, we make it's experimental design. This study is experimental, not clinical, because we try to give tamoxifen. First of all, group is control group. It took. Do you hear me? Because there is signs that internet is not good. Do you hear me? And it's okay. Everything is okay.
Yes, we can hear you, Dr.
Yeah, we can hear you.
Okay, sorry, thank you, because it's a sign that the internet is not it's unstable. Okay, a control group, we give the animals 60 animals, each group is okay. Take sesame oil for 7 days. A second group is took tamoxifen 1 milligram per kilogram in sesame oil. A third group we give it luteolin in high dose with 40 milligram per kilogram and tamoxifen 1 milligram for 7 days. The fourth one is low dose of luteolin is took 20 milligram per kilogram tamoxifen, and finally the fifth group it took luteolin only in high dose 40 milligram per kilogram. So after 7 days, we make decapitation for rats and took the brain and took the liver and make histopathology and some markers. But first, before decapitation or before end of 7 weeks, we make a behavior test to check about the effect of tamoxifen on brain, on movement, of motor, of impairment of cognitive health, if the animal something happened to his brain by tamoxifen or not, and is it good after effect of luteolin or not. So we make behavior test, locomotor assessment, passive avoidance, why-miss test, and we take histopathology examination. And also we make some serum transaminase and liver lipid profile by parametric method to study the effect of liver fibrosis or liver steatosis or whatever the function of liver function. And we measure inflammatory markers like tumor necrosis factor alpha, interleukin 1 beta, transforming growth factor 1 beta, and finally we assessment GSK and beta-catenin. Our results, behaviors, we study the behavior. What is the behavior of Morris-Walter maze test? Morris-Walter maze test is we took the rats first and put it in pool and put platform with 2 centimeter appear and leave the rat to round and put it on the platform. This is controlled for 5 times and leave it the first. Then after he remember that platform position in the pool, we raise the water level and disappears the platform and put the rat again. If he remembers the side of the platform and jump on it, it's good remember. And make this for different 5 groups. tamoxifen group only, and tamoxifen was the Luteolin 40 milligram. Tamoxifen was, and repeat this for a long time until it took a lot of time. This is a study, it's a behavior study, it took a lot of time. And to show or to watch the rat if he remember the platform or not remember, because it's affect on his brain or not. This study make avoiding test also. It's training for rat to enter room. First a normal room, and second normal with second room with slight heat. If he remember to enter or afraid to enter the room, if he forget to this room that is hot, he will enter, and this is happening with tamoxifen group. If he remembers that no, it's not, I'll not enter this room again because it's hot, so it's a good animal, and this is the effect of Luteolin after treatment with tamoxifen toxicity. The third one is diagram of Wynese. We put this rat first for 3 arms, and let him to first, in the first time, let him to go anyway, what he wants. First, he first go to B, then second C, and third A. So after time, it's repeat like this. And sometimes, after treatment, we the rat, maybe he forget to start with the first B. Maybe he started, oh, I will go to this direction, but after some distance, he remembers, no, this is not the first direction that I went before. So he returned back again and go to the first one. If he make like this, because he is good memory, he remembered what happened in the first time. If it's lost his ways, it's become suffered from something happened to his brain. Sorry, it's my dog. So, I'm so sorry. Okay, Leo, stop, please. I'm so sorry. I'm so sorry. Maybe something, some person. Okay, okay, Leo, stop, Leo, please. The second part of okay, second part of study, it's histopathology. It's histopathology. We made the histopathology for. Okay, can you please start? Okay. I'm so sorry. I'm so sorry. I'm so sorry. Come here. Leo, come here. Leo, come here. Leo, come here. Okay, this is good. Come here. I'm so sorry. Histopathology study. We make histopathology for brain and liver. We took. Okay. Our results for the study. Okay, please give me a second to stop the hand.
Okay.
I'm so sorry. I'm so sorry. Okay, our results, we took first the behavior. We found that Luteolin treatment on tamoxifen induced behavioral change. We found that Luteolin here in session 1 or retention, there is no tamoxifen increase retention session, but Luteolin give our return back to the normal with high dose and low dose and the norm and Luteolin alone. On locomotor tests, there is no significant difference between all groups. On Y-means test, tamoxifen decrease Y-means test. He forget which one he the rat go, and Luteolin improve the results of a Y-means test. So effect of Luteolin as in histopathology changes some. I am not a histopathologist. I share this, and he mentions that Luteolin treatment improve tamoxifen-induced neurodegenerative disease. This is a normal group, and I'm not a histopathologist, but it's make and confirm that Luteolin treatment improve tamoxifen-induced neurodegenerative disease. So, Luteolin significantly elevated behavior defect in tamoxifen-induced cognitive impairment in rats, plus Luteolin significantly reversed histopathological neurodegenerative in the cortex and the hippocampal area in tamoxifen-induced model. And we confirm this our result by a previous study that Wang et al. He improved that Luteolin was previously reported to improve memory impairment in Alzheimer's disease due to antioxidant and anti-inflammatory effect. The second part of histopathology on liver histopathology, we make histopathology on liver, and we also found that Luteolin alone group showed a whole improvement, and tamoxifen-induced toxicity for the liver and make liver steatosis, but Luteolin returned back and improved the effect of tamoxifen. Regarding the liver function test like aspartate transaminase or alanine transaminase or lipid profile, where we measured triacylglycerol and total cholesterol. First of all, AST or aspartate transaminase, we found that tamoxifen increased, highly significantly increased AST regarding control, and we found that Luteolin alone or Luteolin with low dose or Luteolin with high dose return it back to normal. And also ALT is increased by tamoxifen. It means that's toxicity, and Luteolin decrease it and return to normal. Regarding triacylglycerol or lipid profile, we found that tamoxifen highly increased the level of triacylglycerol in liver, but Luteolin return it back to normal. And total cholesterol, there is no change in total cholesterol. So we conclude that Luteolin attenuated hepatic steatosis. It reversed increased hyperlipidemia. Luteolin co-treatment decreased hepatotoxicity in serum marker AST and alanine transaminase, and this is confirmed by Farag et al. 2015. He reported that Luteolin could be effective in protecting against hepatotoxicity in mice. Also can effectively decrease hyperlipidemia induced by fatty liver. So what's about the inflammatory markers? Is it changed by tamoxifen or returned to back by Luteolin? Yes, of course. We measure here the 3 inflammatory markers: tumor necrosis factor alpha, interleukin-1 beta, transforming growth factor. First, we found that tamoxifen is increased tumor necrosis factor alpha, and Luteolin in different doses and return it back to normal. And interleukin-1 beta, tamoxifen also increase it highly significant and returned by Luteolin effect. Transforming growth factor beta, it is the same result. So we can conclude from this that before conclusion, effect also Luteolin treatment on GSK3 beta and beta catenin. We found no significant difference between all groups and on GSK. Maybe something. I expect that I found a correlation, but maybe it's not. I don't know. Maybe the kids it's not. Compatible with us, or maybe it's the number of groups not enough, or maybe the dose of tamoxifen is not enough, or the dose of Luteolin, because I know I read about it. It's maybe has a role with liver toxicity and cognitive disease. But in beta catenin, we found that tamoxifen in slightly but significant decrease about than normal control, and Luteolin increase beta catenin in 20 milligram and 40 milligram. So Luteolin increased hepatic inflammatory markers like tumor necrosis factor alpha, interleukin-1 beta, transforming growth factor beta. Also, Luteolin increased beta catenin protein expression, and we can conclude, we can, other previous study, act like us and mention that Luteolin can protect against steatohepatitis through targeting the pro-inflammatory interleukin-1 beta, interleukin-1 and interleukin-18 pathway, in addition to antioxidant effect. Conclusion, we can conclude from these studies, females that suffer from cancer or breast cancer and take treatment of tamoxifen, and it make a side effect for her, she can put treatment with tamoxifen, Luteolin, because it improves fatty liver steatosis. It guard against neurodegeneration disease, act as an anti-inflammatory. Beta catenin considered as novel promising therapeutic in reducing the effect of tamoxifen. Luteolin also improved the cognitive impairment that happen for females suffer, maybe if it suffer from some symptoms like this, we must add Luteolin to her as co-treatment for tamoxifen. Finally, I acknowledge the group, the teamwork group that work with me. Dr. Rana Andil, this is the PhD thesis for her. Dr. Marwa, lecturer of biochemistry at Shams University. Dr. Sarah Wahdan, lecturer of pharmacology, and she made the behavior test with us at Shams University. Professor Dr. Itihal Demirdash, head of pharmacology department, faculty of pharmacy in Shams University. Dr. Aliya Salam, lecturer of biochemistry at Shams University. Dr. Said, professor of histopathology at Al-Azhar University. And final, thank you for us to hear me and all of us together to help women against the cancer or side effect of chemotherapy. Thank you.
Thank you, Dr. Hala, for the interesting presentation. Well, management of side effects in cancer therapy is really important because it increases patient compliance and outcome of therapy.